Hey, now we're going to discuss some of the pre-operative tests that you have to go through prior to actually getting that partial knee replacement. I was surprised how many there were. I will give you the caveat that I do have a cardiac history, so some of the things might be a little more specific for me. But in general, you're going to have to work with your primary care physician to get a clearance for them to do the procedure. That's usually a normal office visit that luckily my doctor contacted my PCP and set up for me. I went through that yesterday. Relatively routine, slight evaluation of the knee, but they just wanted overall general health, blood pressure within range, heart rate, nothing else really going on. With that, they also needed blood work done, again, to make sure that I was relatively healthy enough to go through the procedure. With me, I also have to get clearance through my cardiologist, and that is going to entail an office visit with her, get a clean EKG. Also, they're going to do a chest x-ray for the cardiac side, but also to give a look at my lungs to make sure they're relatively healthy for surgery. Again, a lot of scheduling has to be done with a lot of this. The other thing, and probably the biggest thing that I didn't understand when they said I needed a CT on my knee for this procedure. I'm getting a striker knee replacement in the right partial medial. With that, with the striker model, they actually use a robot, a Mako robot, and they actually have to pretty much have a map of the knee surface to put into the robot, so it knows exactly where to cut the bone out. So it's not just like a regular CT. I had originally asked if I could go to a normal imaging center, and it was explained to me that I actually needed a specific imaging center to get this special sort of CT that can be input into the robot so they can actually see where the damage is and have it line up and cut it. That's probably been the biggest hurdle so far, and it actually wasn't that big of a hurdle. I could see at a busier area it being a little bit more difficult, but that will be done next week, where I will go in for that CT of the right knee, and they can kind of map it out and see exactly where the damage is, and then going to be able to put it into the robot so that the surgeon can actually go in and do the cut. So it's not as easy as just going in, getting evaluated by the doctor, him telling you need a partial knee replacement, and then setting up a surgery date. Probably compared to a normal full knee replacement, I've had friends and family members who've had that done, and that's usually a pretty standard, just get clearance from your primary care, and then go in and get the procedure done. So again, if you're thinking about a partial, especially with the striker model, using the Mako system, just understand you're going to have to allocate enough time to be able to schedule a CT of that knee so that they can input that into the robot to assist the surgeon during the surgery.